Hey everyone, welcome back to Speak Healthy. Today, we are going to talk about 9 things that your ears can surprisingly tell you about your health. Our ears are an incredibly important part of our body, allowing us to hear and process the sounds around us. But did you know that our ears can also provide important clues about our overall health? From the color and texture of our earwax to the presence of ringing or pain, our ears can signal a variety of underlying conditions, some of which may require medical attention. In this video, we will explore 9 things that our ears can tell us about our health, and what to look out for if you suspect that something may be wrong. Number 1. Earwax color and texture. Earwax, or cerumen, is a natural substance produced by our ear canals to protect the delicate skin and inner ear from dirt, dust, and other harmful particles. While many people may view earwax as an unpleasant or unsanitary substance, it serves an important role in maintaining the health of our ears. However, the color and texture of our earwax can also provide important clues about our overall health. Dry and flaky earwax, for example, could be a sign of a skin condition such as eczema or psoriasis. In some cases, excessive dryness of the earwax may also be caused by overcleaning or using certain types of earplugs or hearing aids. In contrast, dark and sticky earwax may indicate the presence of an ear infection, as the bacteria and fungi that cause these infections can alter the color and texture of the earwax. In addition to these factors, the consistency and amount of earwax produced by our bodies can also vary based on a range of factors, including age, genetics, and overall health. While some people may produce more earwax than others, excessive earwax buildup can lead to discomfort, hearing loss, and other problems. In some cases, it may be necessary to seek medical attention to have the earwax safely and effectively removed. Number 2. Ringing in the ears. Ringing in the ears, also known as tinnitus, is a common condition that affects millions of people worldwide. It is characterized by a persistent ringing, buzzing, hissing, or humming sound in the ears, even when there is no external source of sound. While tinnitus can be a temporary or minor annoyance for some people, for others it can significantly impact their quality of life, making it difficult to concentrate, sleep, or engage in daily activities. One of the most common causes of tinnitus is hearing loss, particularly age-related hearing loss or noise-induced hearing loss from exposure to loud noises. As we age, the delicate hair cells in our inner ear that are responsible for converting sound into electrical signals can become damaged, leading to hearing loss and tinnitus. Similarly, exposure to loud noises, such as from music concerts or heavy machinery, can cause temporary or permanent damage to the hair cells, leading to tinnitus. However, tinnitus can also be a symptom of other underlying health conditions, such as high blood pressure, anxiety, or depression. In some cases, tinnitus may be a side effect of certain medications, such as antibiotics or antidepressants. Other potential causes of tinnitus include ear infections, Meniere's disease, and acoustic neuroma, a non-cancerous tumor that develops on the nerve that connects the ear to the brain. While there is no cure for tinnitus, there are a variety of treatments that can help manage the symptoms and improve quality of life. Depending on the underlying cause of tinnitus, treatment options may include hearing aids, sound therapy, medication, or cognitive behavioral therapy. In some cases, making lifestyle changes, such as reducing exposure to loud noises, managing stress, and getting enough sleep, can also help alleviate tinnitus symptoms. Number 3. Ear pain. Ear pain, also known as otalgia, is a common symptom that can occur due to a variety of underlying conditions. While ear pain can be mild and temporary, in some cases it can be severe and persistent, interfering with daily activities and quality of life. Understanding the potential causes of ear pain is important in determining the appropriate treatment and preventing potential complications. One of the most common causes of ear pain is an ear infection, also known as otitis media. Ear infections occur when bacteria or viruses infect the middle ear, causing inflammation and fluid buildup. In addition to ear pain, other symptoms of an ear infection may include fever, headache, dizziness, and hearing loss. In most cases, ear infections can be treated with antibiotics or other medications to relieve pain and reduce inflammation. However, ear pain can also be caused by other underlying conditions, such as injury to the ear or surrounding areas, temporomandibular joint disorder, TMJ, or a more serious condition such as a tumor or neurological problem. In some cases, ear pain may also be referred pain from other parts of the body, such as the teeth or throat. Number 4. Hearing loss. Hearing loss is a common condition that affects millions of people worldwide. It can occur gradually over time or suddenly, and can significantly impact a person's quality of life, making it difficult to communicate with others, enjoy music or television, and even affect their safety. Understanding the potential causes of hearing loss is important in determining the appropriate treatment and preventing potential complications. One of the most common causes of hearing loss is age-related hearing loss, also known as presbycusis. This type of hearing loss occurs gradually over time, typically starting in the mid to late 50s, and is often accompanied by tinnitus or ringing in the ears. Age-related hearing loss is caused by changes in the structure of the inner ear, including damage to the hair cells that are responsible for transmitting sound to the brain. Another common cause of hearing loss is noise-induced hearing loss, which occurs when a person is exposed to loud noises, such as music concerts, machinery, or firearms, over a prolonged period of time. The loud noises can damage the hair cells in the inner ear, leading to hearing loss. However, hearing loss can also be a symptom of other underlying health conditions, such as diabetes, high blood pressure, or heart disease. In some cases, medications, such as chemotherapy drugs or antibiotics, can also cause hearing loss as a side effect. Other potential causes of hearing loss include ear infections, Meniere's disease, and acoustic neuroma, a non-cancerous tumor that develops on the nerve that connects the ear to the brain. Number 5. Dizziness and vertigo. Dizziness and vertigo are common symptoms that can cause a feeling of disorientation or unsteadiness, making it difficult to maintain balance and coordination. These symptoms can occur for a variety of reasons, including underlying health conditions, medications, or ear problems. Understanding the potential causes of dizziness and vertigo is important in determining the appropriate treatment and preventing potential complications. One of the most common causes of dizziness and vertigo is inner ear problems, which can include vestibular neuritis, labyrinthitis, or Meniere's disease. Vestibular neuritis and labyrinthitis are caused by inflammation of the vestibular nerve or the labyrinth, respectively, and can result in symptoms such as dizziness, vertigo, nausea, and hearing loss. Meniere's disease is a chronic condition that affects the inner ear, causing episodes of vertigo, tinnitus, and hearing loss. Other potential causes of dizziness and vertigo include head injuries, low blood pressure, anxiety, and medication side effects. In some cases, dizziness and vertigo may also be a symptom of a more serious condition, such as a stroke or brain tumor. Number 6. Ear discharge. Ear discharge, also known as otorrhea, is a common symptom that can occur for a variety of reasons. The type and color of the discharge can provide important clues about the underlying cause, and it is important to seek medical attention if you experience ear discharge to determine the appropriate treatment and prevent potential complications. One of the most common causes of ear discharge is an ear infection, which can cause the buildup of pus or other fluids in the ear canal. Ear infections can occur in the middle ear, outer ear, or inner ear, and can be caused by bacteria, viruses, or fungi. Other symptoms of ear infections can include pain, fever, and hearing loss. Ear discharge can also be a sign of a ruptured eardrum, which can occur as a result of trauma, infection, or changes in pressure. A ruptured eardrum can cause ear pain, hearing loss, and ringing in the ears, and can increase the risk of infections. In some cases, ear discharge may also be a symptom of a more serious condition, such as a tumor or neurological problem. Other potential causes of ear discharge include earwax buildup, foreign objects in the ear canal, and certain medications. Number 7. Swelling and redness. Swelling and redness around the ear can be a concerning symptom that may indicate an underlying health issue. While these symptoms can occur for a variety of reasons, they are often associated with infections, injuries, or allergic reactions. One of the most common causes of swelling and redness around the ear is an infection, such as an ear infection or a skin infection. Ear infections can cause swelling and redness around the outer ear or ear canal, and can be accompanied by symptoms such as pain, discharge, and hearing loss. Skin infections, such as cellulitis or impetigo, can also cause redness and swelling around the ear, as well as fever, tenderness, and fluid-filled blisters. Swelling and redness can also be a sign of an injury, such as a blow to the ear or a cut or abrasion. Injuries to the ear can cause swelling, redness, pain, and bleeding, and may require medical attention to prevent complications such as infection or hearing loss. Allergic reactions can also cause swelling and redness around the ear. Allergies can be caused by a variety of triggers such as insect bites, medications, or food, and can cause symptoms such as itching, hives, and swelling. Number 8. Itching. Itching inside the ear can be a bothersome symptom that may indicate an underlying health issue. While itching can occur for a variety of reasons, it is often associated with infections, allergic reactions, or skin conditions. One of the most common causes of itching inside the ear is an infection, such as an ear infection or a fungal infection. Ear infections can cause itching and discomfort in the ear canal, as well as pain, discharge, and hearing loss. Fungal infections, such as otomycosis, can also cause itching and a feeling of fullness in the ear, as well as discharge and hearing loss. Allergic reactions can also cause itching inside the ear. Allergies can be caused by a variety of triggers such as dust, pollen, or pet dander, and can cause symptoms such as itching, hives, and swelling. Skin conditions, such as eczema or psoriasis, can also cause itching inside the ear. These conditions can cause redness, flaking, and itching on the skin, and can sometimes affect the ear canal. Number 9. Changes in ear shape or size. Changes in the shape or size of the ear can be concerning and may indicate an underlying health condition. These changes can be due to a variety of reasons, such as a congenital abnormality, injury, or tumor. A congenital abnormality is a birth defect that affects the development of the ear. Some examples of congenital abnormalities that can cause changes in ear shape or size include microtia, a condition in which the outer ear is underdeveloped or absent, and macrotia, a condition in which the outer ear is larger than normal. An injury to the ear can also cause changes in its shape or size. Trauma to the ear, such as a blow to the head, can cause damage to the cartilage or bones that make up the ear, leading to changes in its appearance. Ear piercing or other types of ear surgery can also cause changes in the shape or size of the ear. In some cases, changes in ear shape or size can be a sign of a tumor. Tumors that affect the ear can be benign or malignant and can cause a variety of symptoms, including changes in ear shape or size, hearing loss, ear pain, and dizziness. As you've learned, our ears can provide valuable insights into our overall health. From the color and texture of earwax to changes in ear shape or size, various symptoms and conditions can indicate underlying health issues. It is important to pay attention to these signs and symptoms and seek medical attention when necessary to ensure timely and appropriate treatment. Regular checkups with a healthcare provider can also help identify and address potential ear and hearing health concerns.